you very much indeed, and hello everyone. Again, it's a real pleasure to be invited to talk on this really important topic. The problem of antimicrobial resistance is such a threat to us all, and in treating pyoderma, we're probably the biggest use of antimicrobials in small animal practice, and because it keeps on happening and keeps on recurring, it's a real risk for getting resistant organisms whilst you're doing the treatment. So getting to grips with this, doing it in the best possible way is going to be a big advance, I think, for us all. So we're going to talk about the approach to therapy in skin infection. Then we'll deal briefly with the problem of antimicrobial resistance. We'll spend most of the time talking about prudent selection and use of antimicrobials. Including in that, we'll talk about how to deal with MRSA, and then finally we'll talk about effective hygiene before reviewing the key points. So we're talking about skin infection, but here of course we're focusing on bacterial infection, and as we know they're very common, but importantly they're almost always secondary. Successful treatment depends on the right kind of therapy, that means the right drug, the right dose, and very importantly, good compliance by owners, something that sometimes we don't focus on enough. And of course, we need to resolve the underlying causes, otherwise the disease will come back. A careful diagnostic approach is essential. We need to define the type of infection and the causative bacteria, and of course, again, we need to find out about what underlying diseases there are, and also think about other causes. For instance, dogs that are being worked, or dogs that are being kept in inappropriate environments, or if there's malnutrition, things like this, which are not really diseases, can actually render animals more susceptible to skin infection. And then, of course, we've got to select the appropriate therapy, and remember that both systemic and topical therapy can be used and they can be combined. And we may also be using adjunctive therapy. For instance, if we've got skin that's in rather poor condition, perhaps with a scaling or crusting problem associated with the infection, we may find that topical therapy with keratolytic shampoo or something like that will be appropriate to go along with the systemic therapy if we're not using topical therapy to treat the infection. Duration of treatment needs to be appropriate, so we treat until lesions have resolved, and then for either 7 days for superficial pyoderma or 14 days longer for deep pyoderma. And we as clinicians need to be the people who determine whether lesions have resolved or not. It's not good to do this on the phone. Clients will mistake this, and this is also one of the reasons why we don't want to use glucocorticoids either systemically or topically, because these will actually camouflage the lesions and make them look as though they've resolved earlier. And for clients, this may lead to poor compliance. They may stop using the treatment, and for us as clinicians, we may be deceived into thinking that the lesions have resolved sooner than they really have. So the resistant bacteria that we're particularly concerned with, we can divide into the methicillin-resistant staphylococci and a group of gram-negative bacteria, as you can see here. So the gram-positives, the methicillin-resistant bacteria, the one that first started causing us problems was MRSA, and in fact we described those first cases in 1999, so 15 years ago. It doesn't seem that long actually. And these were cases that came from human hospitals, and there's now very good evidence to show that these are nearly always human hospital type MRSA, and there's nearly always a link, either direct or indirect, to a hospital, a person who works or has been to hospital, or somebody with a family member who maybe has a lesion or has been to hospital. We've actually learnt how to deal with the MRSAs quite well over the last 15 years. And at the RVC, we seldom lose cases with MRSA nowadays. As far as today is concerned,